Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Wbhrb Staff Nurse Grade 2 2025 CBT based question answer Part 24. Let's start. The first question. Post thyroidectomy, a patient develops tingling around mouth. What should the nurse suspect? Option A, hyperkalemia. Option B, hypocalcemia. Option C, hypoglycemia. Option D, hypermagnesiemia. The correct option is option B, hypocalcemia. During CPR, the nurse feels a palpable pulse while giving compressions. What should be done? Option A, continue CPR. Option B, call for defibrillation. Option C, stop compressions and check rhythm. Option D, increase rate of compressions. The correct option is option C, stop compressions and check rhythm. While inserting an NG tube, the patient starts coughing violently. What should the nurse do? Option A, withdraw tube immediately. Option B, give water to drink. Option C, reconfirm equipment. Option D, push tube deeper. The correct option is option A, withdraw tube immediately. A patient with DKA is receiving insulin infusion. What parameter must be monitored closely? Option A, serum sodium. Option B, serum potassium. Option C, serum calcium. Option D, urine chloride. The correct option is option B, serum potassium. Which of the following is a presumptive sign of pregnancy? Option A, ballotment. Option B, positive pregnancy test. Option C, fetal heartbeat. Option D, amenorrhea. The correct option is option D, amenorrhea. Causes of peripheral cyanosis is dash. Option A, arterial obstruction. Option B, venous obstruction. Option C, cold exposure. Option D, all of these. The correct option is option D, all of these. Height of neonate doubles by option A, 4 years. Option B, 2 years. Option C, 1 year. Option D, 5 years. The correct option is option A, 4 years. National Vector-Borne Disease Control Program does not include dash. Option A, malaria. Option B, filariasis. Option C, Kala-Azar. Option D, measles. The correct option is option D, measles. Name the 2 endocrine glands which secrete their hormones when they receive orders from the pituitary through its hormones. Option A, adrenal and pancreas. Option B, thyroid and testes. Option C, adrenal and spleen. Option D, pancreas and ovary. The correct option is option B, thyroid and testes. Which fetal position is most favorable for normal delivery? Option A, left occiput anterior. Option B, right occiput posterior. Option C, left occiput transverse. Option D, right mentum anterior. The correct option is option A, left occiput anterior. When caring for a patient who has intermediate claudication, nurse advises the patient to option A, apply guarded compression stockings. Option B, elevate the legs when sitting. Option C, refrain from vigorous exercise. Option D, walk as much as tolerated. The correct option is option D, walk as much as tolerated. Which nursing diagnosis is most appropriate for a patient with chronic venous insufficiency? Option A, activity intolerance. Option B, body image disrupted. Option C, fluid volume deficiency. Option D, skin integrity impaired. The correct option is option D, skin integrity impaired. A lethargic patient has fever, vomiting, headache, and the nurse has to prepare him for which one of the following procedure? Option A, blood culture. Option B, lumbar puncture. Option C, CAT scan. Option D, ultrasound exam. The correct option is option B, lumbar puncture. Which condition places a patient with cardiac illness at increased risk of sudden death? Option A, depression. Option B, anxiety. Option C, bulimia. Option D, chest pain. The correct option is option D, chest pain. A clinical sign of impending death is option A, Stokes respiration. Option B, increased movement of extremities. Option C, increased muscle tone. Option D, worrying. The correct option is option A, Stokes respiration. In fetal blood vessels, where is the oxygen content? Option A, umbilical vein. Option B, ductus venosus. Option C, ductus arteriosus. Option D, pulmonary artery. The correct option is option A, umbilical vein. Which of the following is an essential air quality standard for maintaining a safe operating room environment? Option A, maintain 25 to 28 degrees Celsius temperature with humidity below 20%. Option B, avoid pressure monitoring across the filter bed. Option C, ensure 15 to 20 air changes per hour with humidity 30 to 60%. Option D, reduce air exchanges to less than 5 per hour to prevent contamination. The correct option is option C, ensure 15 to 20 air changes per hour with humidity 30 to 60%. During the course of a chronic illness, which stage is characterized by an increase in severity of symptoms or recurrence of the disease at its peak level? Option A, remission. Option B, exacerbation. Option C, progressive degeneration. Option D, terminal illness. The correct option is option B, exacerbation. Which of the following is the feature of Alzheimer's disease? Option A, early memory loss. Option B, recent and past memory loss. Option C, global memory loss. Option D, recent memory loss. The correct option is option B, recent and past memory loss. Culture media is sterilized by which of the following method? Option A, autoclaving. Option B, hot air oven. Option C, boiling. Option D, ionizing radiation. The correct option is option A, autoclaving. Glucose is added to antidiarrheal solution because option A, it tastes sweet. Option B, it increases absorption of amino acids. Option C, it increases absorption of sodium. Option D, all of the above. The correct option is option C, it increases absorption of sodium. The islets of the Langerhans are found in which of the following? Option A, stomach. Option B, pancreas. Option C, alimentary canal. Option D, liver. The correct option is option B, pancreas. Pancreatic juice secretion is caused by option A, secretin. Option B, gastrin. Option C, enterogastrone. Option D, enterokinase. The correct option is option A, secretin. The common passage for pancreatic juice and bile is option A, stomach. Option B, ampulla. Option C, duct of Wirsung. Option D, duct of ODI. The correct option is option B, ampulla. Which of the following is the major cause of postpartum hemorrhage? Option A, preeclampsia. Option B, incoordinate uterine action. Option C, atonic uterus. Option D, thrombin. The correct option is option C, atonic uterus. Which of the following is considered the most important risk factor for developing esophageal adenocarcinoma? Option A, alcohol consumption. Option B, hot and spicy foods. Option C, male gender. Option D, Barrett's esophagus. The correct option is option D, Barrett's esophagus. What do you mean by complete cervical dilation during labor? Option A 4 cm, option B 8 cm, option C 10 cm, option D 12 cm. The correct option is option C 10 cm. Which of the following pairs is incorrectly matched? Option A Cushing syndrome, cortisol, option B diabetes, insulin, option C goiter, thyroxine, option D acromegaly, adrenaline. The correct option is option D acromegaly, adrenaline. Which action reduces ventilator associated pneumonia, VAP? Option A keeping humidity high, option B suction every 1 hour, option C elevate HOV 30 to 45 degree, option D use low tidal volumes. The correct option is option C elevate HOV 30 to 45 degree. The major supporting structure of the uterus extending from the side of the uterus to the lateral pelvic wall is the option A round ligament, option B cardinal ligament, option C uterosacral ligament, option D broad ligament. The correct option is option D broad ligament. Thick yellow drainage from the wound is known as option A purulent, option B serous, option C sanguineous, option D none of the above. The correct option is option A purulent. Passive immunization is achieved by option A vaccines, option B antisera or antitoxins, option C by birth itself, option D none of the above. The correct option is option B antisera or antitoxins. Which is also known as the accessory dietary factor? Option A fats, option B vitamins, option C proteins, option D hormones. The correct option is option B vitamins. Base present in DNA but absent in RNA is option A thymine, option B uracil, option C cytosine, option D guanine. The correct option is option A thymine. Major route of transmission of hepatitis A is option A perinatal transmission, option B parenteral route, option C sexual transmission, option D fecal oral route. The correct option is option D fecal oral route. Ventricular pacing lead ECG shows option A LBBB pattern, option B rBBB pattern, option C LVH, option D extreme LAD. The correct option is option A LBBB pattern. QRS widening with slurred S waves in lateral leads suggests option A rBBB, option B LBBB, option C WPW, option D AFIB. The correct option is option A rBBB. A patient on mechanical ventilation suddenly shows high pressure alarm. What is the first nursing action? Option A increase tidal volume, option B suction the patient, option C reduce PEEP, option D check for kinks or obstruction in tubing. The correct option is option D check for kinks or obstruction in tubing. What is the cause of psychological anemia in pregnancy? Option A increased RBC destruction, option B iron deficiency, option C plasma volume expansion, option D low iron absorption. The correct option is option C plasma volume expansion. The uterus become abdominal organ at option A 8 weeks, option B 10 weeks, option C 16 weeks, option D 12 weeks. The correct option is option D 12 weeks. Which hormone maintains the corpus luteum during early pregnancy? Option A HCG, option B LH, option C oxytocin, option D estrogen. The correct option is option A HCG. neonates compression ventilation ratio? Option A 1:1, option B 1:2, option C 3:1, option D 1:4. The correct option is option C 3:1. Vomiting in neonates may occur due to following non-organic causes except dash. Option A irritation of the stomach due to solid amniotic fluid and blood. Option D autophagy. Option C faulty feeding technique. Option D Hirschsprung's disease. The correct option is option D Hirschsprung's disease. In a 2 to 12-month baby, which respiratory rate may be an indicator of pneumonia? Option A more than 60 per minute. Option B more than 50 per minute. Option C more than 40 per minute. Option D more than 30 per minute. The correct option is option B more than 50 per minute. Therapeutic INR for warfare therapy. Option A 1.0 to 1.5. Option B 3.5 to 4.5. Option D 2.0 to 3.0. The correct option is option D 2.0 to 3.0. The primary treatment for a patient with symptomatic complete heart block is option A pacemaker implantation, option B coronary angioplasty, option C thrombolytic therapy, option D cardioversion. The correct option is option A pacemaker implantation. When recording a patient's fluid intake, the nurse should know that 1 ounce is approximately equal to option A 10 ml, option B 100 ml, option C 250 ml, option D 30 ml. The correct option is option D 30 ml. The screening test for cervical cancer under NPC DCS is option A pap smear, option B biopsy, option C HPV DNA test, option D blood test. The correct option is option A pap smear. The ideal time for first antenatal checkup is option A at 20 weeks, option B after 24 weeks, option C within 12 weeks, option D at 32 weeks. The correct option is option C within 12 weeks. RMNCH+A strategy integrates care for option A reproductive male care, option B reproductive, maternal, newborn, child and adolescent health, option C rural medical network, option D referral maternal node care. The correct option is option B reproductive, maternal, newborn, child and adolescent health. Thank you for watching. Please like and subscribe.